Yes. Good evening, everybody. Welcome to the May meeting of the Tahoe Forest Board of Directors. We'll call open session to order. David, if you could report on the actions taken in closed session.
Sure. The board considered 3 items in closed session. The first one, 5.1, the third quarter quality report. That report was approved 5-0. The second item, the closed session minutes, that was also approved on a 5-0 vote. And finally, medical staff credentialing 5.3, that one was also approved on a 5-0 vote.
All right, thank you very much. Do we have any deletions, corrections to the posted agenda, the open session agenda?
None from staff?
No. And then, do we have any audience input this evening? All right. Just a reminder, this is an opportunity for members of the public to address the board on items which are not on the agenda. If you wouldn't mind, state your name for the record. And
Okay.
Comments are limited to 3 minutes. And just a reminder, we cannot take action on anything discussed in public comment.
Thank you. Good evening. My name's Danielle Hughes, and I am with the Interim Executive Committee of Eastern Placer Future. As some of you may heard, we are actually looking at exploring incorporation of Eastern Placer County, and we wanted to come to share this information with you and the members of your that are in here, your employees and your community constituency, and also offer up, if you're interested, a full presentation of what we're doing. Our website is easternplacerfuture.org, and there's lots of information, frequently asked questions on what this looks like, what we're doing with municipalization, what we're not doing with special districts. And, you know, there is a lot of information to share there, and we could happily provide additional information. We have found employees at different boards are interested in asking questions, and even community members that may typically not go to a board have been coming to ask questions. You know, we're a group that's pretty passionate. It's a pretty diverse group of representatives in the community that have engaged across a variety of different policies and projects in the region, and just think it's time for us to have a local voice on decisions. It's not about what we decide, it's who decides for us. So we just want to be here if you have any questions, and please go ahead to our website at any time. Thank you.
Thank you very much. Any other public comment? Seeing none. Do we have input from employee associations?
Hi, I'm Abby Thomas. I'm a nurse at the Cancer Center, and I'm the treasurer of the EAP. So I'm on the EA board and representing EAP tonight. And just in terms of kind of priorities right now, the couple updates. Julie Morgan, our president, has been elected to the executive board of AFSCME, our local chapter. So she's engaged with them actually on a meeting this evening, so that's why she's not here. And then in terms of priorities, we're obviously just kind of teeing up for the negotiations that are forthcoming. We had the contract extension, and then we'll be starting those in earnest, I think, in the fall. And so we've been collaborating with Lauren on that and pulling the members on their priorities.
Thank you very much. Any others? No? All right. Medical Staff Executive Committee, Dr. Koch. Welcome back.
All right, so I'm here to review the consent agenda, and it is a long consent agenda, but it has been summarized fairly straightforward, in a straightforward manner. The policies with changes, I'm just going to go through generally what we have here. In the interventional radiology department, mostly it was just added risk statements, but there was a change with RVU minimums, daily coverage, and quality metric lines. So sort of technical in the weeds stuff, but not any kind of sea change. And then in the next group of policies, mammography, it was just risk statements. In the next group, this is where there were two things to comment on. The first is, this is the X-ray department, and this is for IV contrast, and we changed the GFR requirement to to greater than 30 rather than 60, which is what it used to be, which just allows more people to get contrast studies than we used to allow without having to go through as many hoops. And this is based on data. GFR. Glomerular filtration rate, how fast your kidneys are processing the dye, and whether your kidneys can handle the hit from the dye. Yeah. And then the next thing is they removed the sentence, "See protocol for contrast infiltration," in the infiltration protocol, and that's because they were referring to something that didn't exist. The protocol is the policy. And somehow within the policy, they had a sentence that said referring to the policy, or referring to the protocol, but there is no other protocol other than the one that's the policy, if that makes sense. A little convoluted there. Nuclear medicine, there were no changes other than risk statements, same with ultrasound. And then there was one new policy, and this is the occupational health registered nurse policy that allows them to do what primary care nurses have been doing for the primary care providers on a slightly smaller scale, meaning that they can use similar guidelines to the primary care indirect nursing teams and make outreach to patients, handle inbox questions for patients within certain parameters with regards to lab results. So they can review the labs, they can determine it's normal and just inform the patient. They can take mildly abnormal labs and take action on them. And then seriously abnormal labs, they can discuss with the provider before they take care of them. And so this policy is slightly more restrictive than the one for primary care just because it's occupational health and there's a lot more personal health information consequences because we're dealing with all the employees in the hospital. Yeah. And so that's the consent agenda, and we would like to request approval of all of it as is.
Any questions, comments?
No, but thank you.
Yeah.
Thank you for the summary that you gave us so that we know that most of it all had to do with risk statements, and the ones that had changes, you summarized very well. Thank you.
Thank you. And that format works? This is acceptable going forward? Okay.
Yeah, this
Excellent.
is a change. I was going to make a comment on that there's over 4,000 policies that the board, in theory, has to have eyes on. This was what we came up with as the best way to most importantly, that we as the board understand there is a structured policy, or a structured procedure for reviewing policies that's being maintained. When it's something as simple as a risk statement being added, if anyone needs to or wants to see the specific policy, those are available, but to avoid having a 1,800-page board packet, they're not included here in just the summary table. So if that is working for everyone, we'll continue with that, but please, any comments if we need additional information or whatnot.
I think my one question is just, we talked just the added risk. Is this a statement that just had to be added to these protocols?
Right. It was a new requirement that all policies have a risk statement. In other words, a justification why you need this policy. What was the risk you're trying to mitigate in order to have to create this policy? And so we didn't used to have risk statements. We had a different kind of statement at the start, a purpose or something like that. But now it has to be framed in the context of risk statement. It has to have the word, this is the risk that we are mitigating through this policy.
And who made that requirement?
The state?
Well, I think it was high reliability.
Oh,
that-
okay.
I think it was an improvement, frankly. I think it's great.
Great.
Okay, wonderful. Any audience input, questions? All right, this is an item for board action, so we can get a motion.
I move that we accept or we approve the med
Consent.
staff consent agenda as written.
I'll second the motion.
We have a motion and a second. All in favor?
Aye.
All opposed? All right, approved 5-0. Thank you very much. All right, moving to the consent calendar. These items are expected to be routine, non-controversial. We do have the opportunity, if anyone wants to pull an item from the calendar, we can do so and discuss later. Any items to be pulled?
I don't have it.
No? All right. I didn't want to pull anything, but I did want to spotlight a change in some of the reporting that I find incredibly refreshing. Just very concise detail, but also, I think, a broader look at what we're doing and how we're engaging. So from the CEO report, talking about high-demand services lab and imaging services becoming, working to be more affordable and accessible, clearly a hot topic that we've raised a lot. And so to hear and see there's action being taken against that's fantastic. Louis, you're here, and in your report, expanding to go beyond just what are we doing inside the hospital, reference to Harvest of the Month, how many students are being impacted by that, coalition meetings, how are we working with other agencies, other organizations outside the health system, and of course, the work around the BEAR program around belonging, empathy, access, and respect, and that's been a huge focus, for the organization and supporting our entire team more. So just wanted a note of gratitude to I think seeing some changes to the reports, and I found them incredibly, they were actually fun to read. I was like, oh, there's good stuff in here.
So in the
So thank
future,
you.
are we going to have any of the chiefs actually doing verbal reports? Because we started that and then we
Yeah,
ran out of chiefs.
Yeah, we started that. I think what it wasn't necessarily driving the feedback or the impact that we were looking for. And so what we've been talking about is tying towards our winning aspirations and having, because this is something that you've actually talked about a lot in the past, like we've got all these great strategic plans, but often very light detail on where are we relative to those plans. And so perhaps, and this is a work in progress, we're figuring out the best way to do it, but maybe it's every other meeting. We'll have a detailed update on where we are towards one of the peaks.
Yeah.
Yeah, but great question. Thank you. All right. With that, any other comments, questions, audience input? Hearing none. Okay, looking for a motion on the consent calendar then.
I would make a motion that we accept the items on the consent calendar.
I'll second that.
Motion and a second. All in favor?
Aye.
All opposed? All right, approved 5-0. Thank you very much. All right. Agenda item 14.1, first item, Tahoe Truckee Regional Homeless Action Plan. And this is, again, an item for board action, so we'll be looking to approve that. Looks like, Ted, you'll be kicking off the conversation? All right, thank you.
Yeah, I think we can make this work. No, that one can't reach all the way anyway. Chair McGarry, Directors, Ted Owens, Executive Director, Governance and Business Development. And I have with me tonight our guest, Jasmine Bro, who's a Program Manager for both Eastern and Nevada County for many years, and I hold her in exceptionally high regard. She is the individual that pulled together the warming shelter the year before this past one, and you had a great time doing that. I don't think that's true, but but nevertheless, we're very fortunate to have Jasmine here tonight with us. With that, we'll start. We have an 87-slide presentation for you. I hope that's just kidding. It's been narrowed down. Just wanted to see if you were listening. We do know we have a time limitation, so we're going to go through it fairly quickly. We do have some guests that Jasmine will introduce that are here and available to answer any detailed questions that you may have. This report was done with the help of the consultant. We have Allison Schwedner here with us, Agnew Beck, and Shauna Doherty, who could not be with us this evening, but that's where the work came from. All right, it works. Just a real quick overview. Essentially, the area that was studied is the school district boundary, which is almost identical to our own boundary with some minor deviations in Tahoe. The region, it was an 18-month process. There were diverse partners that were involved. You'll see that in a moment. Some of them are listed right down there. The funding sources came from the Community Foundation and some TA funding for data analysis. And as I said earlier, Agnew Beck was the consultant. These are the partners. It's nice to see us at the top and in the middle. We were a partner, both myself and Alice Wong were representing the Tahoe Forest Health System during the process. We do owe a thank you to the chairs. They were Hardy Bullock, Nevada County District 5 Supervisor, and Cindy Gustafson, Supervisor of Placer County. And I'd like to give a shout out to Jan Zabriskie, Mayor of the town of Truckee. Jan really, I felt, was a leader and a pusher and was present at all of those things. Now, I know that the supervisors have a lot of business off the hill, so they couldn't make everything. They supported it as well, but Jan really was pretty exceptional there. We know Kathy Foley, AMI, North Lake Tahoe Homeless Services, for many years has run the warming shelter here in Truckee. Christina Kind was the lead staff person coming from the Community Foundation. And Cindy Basso, you may know, ran for our board a couple of years ago. She did not rest or let moss grow under her feet. She immediately got involved in the homelessness issue, and she is a very active community participant and does a lot of pro bono legal work as well in that space. And of course, my hero, Jasmine Bro from Nevada County, who's going to take over for me in a minute here. Just real quick, the planning process, I don't need to read through this, but the real main thing with the audit was to identify the gaps assessment. Although we did look at best practices and what have you, when we got to the input, we had a lot of input from the community. Lived experience input, which is kind of interesting. We actually took a field trip one day to South Lake Tahoe, who is, South Lake Tahoe's further along in addressing issues of homelessness, but they also have different community and a different lay of the land, which we don't have up here, that made it a little bit easier. For example, the ability to take old hotels and repurpose them. We don't happen to have any. So it's kind of an inhibitor for us. Then, of course, the idea was the third process, plan development, which we're going to talk about tonight, an introduction to the community. And there it is. And I know it was in your packet. And if you read all of it, I applaud you. And if you read it over time, I think that's excellent too. There is an extremely large amount of data located in that plan. It had 4 strategic areas where I touched on just a little bit a moment ago. First off, I wanted to point out that the data showed that we had, when we started this, we had 78 unserved households in the area, and that's a variation of high and medium vulnerability households. So, and it changes seasonality-wise too. So, first focus area is crisis stabilization. We know we have a problem. We didn't have a warming shelter last year, and we did our best. I think the community did its best to deal with that situation, but it's not satisfactory. So the second focus area is stable housing in the high vulnerability areas. So this would be people that might have behavioral mental health issues that are very, very vulnerable and need a specific type of housing. Focus area 3, partnership and structure. And this is where we're going to be probably talking more about in the future when we talk about implementation and funding. Focus area 4 is sustainable funding, and it seems to be the issue du jour for many initiatives in the community, but very much so in this one. By the way, we are not, and there will not be a financial ask this evening, so, but I think you might see us again in the future.
Don't take my thunder.
Oh, that's right. This is your turn. I was having so much fun in control of this. With that, why don't I switch seats and you sit right here and I'll step to the side. I had the power of the clicker. There you go. It's these two right there.
Competition for my job. And then Ted did such a great job overviewing the 4 buckets. And then over all of the buckets is prevention. We want to prevent people from entering into homelessness. so that we have a good inflow, an outflow of people exiting homelessness when they come in to our system. And so prevention is over everything that we're going to talk about in a minute. I did want to talk about the data collection that we did. So this was the first time that we've done a comprehensive study of the needs of our community. It had always been pieced together in various ways. And so we were able to engage a consultant through the state, funded through the state of California with the California Medi-Cal transformation. And so they did a deep dive into the existing systems we have, the data, and all the data was taken from our homeless management information system, which is our case management system. So that really reflects the core individuals that are here throughout the year. This is their home, this is their community, they are here for a reason. And there are pieces of data that was looked at around individuals that come in and out of our community, maybe seasonality. But when we're talking about this unmet housing need, we're really talking about our friends and neighbors that live in this community. And so we've got Sierra Community House, and then we have the day center that is currently operating out of the back area of the Joseph Center right across the street. And this is a bunch of math just to show you kind of how we got to the number 78, and then we're going to work backwards around how we meet the needs for those 78 individuals. Our guiding principles, the big takeaway here is that doing nothing causes significant economic impact. You see that showing up in the emergency department on stormy nights. You see that showing up in calls for service for individuals that don't have a home, with the police responding, emergency response. And so really doing something is the right thing because compassion is key, and because it costs less money when people are indoors and not surviving every day out in the streets and the elements. Our plan is aspirational, so we seek to end homelessness within 5 years. We have some interventions around housing that may or may not be achievable, but if we don't have a roadmap, then we don't know where to go. So that's what you'll see. We talked about this, so prevention is over everything, and then ideally our community would have a continuum of care, and so that would start with the crisis stabilization that Ted talked about. So that's the navigation center, that's the interim beds, that's where someone goes when they're literally on the street tonight. And then we have permanent supportive housing, and so in our region we currently have, in Kings Beach, Placer County has set up Brown Bear Studios, so that's 13 units of permanent supportive housing, and then Nevada County is working on bringing 10 units of permanent supportive housing within the Pacific Crest Commons, which will be located at the old CHP site. And then we have a variety of affordable housing in our community currently. I don't know the exact number of units, but that would be things like the artist lofts, like Fisherman's Hollow. So units that are affordable but don't necessarily have services attached to them, which is what permanent supportive housing is. And then everything is the housing first model. So we're meeting people where they are. The expectation is that people are able to follow rules and follow a lease, but that does not mean that we are drug testing everyone. So your behavior is what allows you to stay in the program. And oftentimes we will see behaviors that become disruptive and that may be related to substance abuse, but it may not be. And so that's not the premise that we are leading with. And that's always a big sticking point for a lot of community concerns around, well, how are we managing that? So we talked about the crisis response. I mean, as you know, we do not have a formal emergency shelter option at this point in our community, and that's for a variety of reasons. It's kind of, well, where does it go? Who do we fund? How does it get funded? Who runs it? And it's just kind of this revolving conversation that feels like we don't actually get anywhere, because we're always trying to figure out first thing, and then, well, we don't know what the second thing is. And we actually have Volunteers of America in the audience with us today, and they are a provider that we've been engaging in conversations, and they're here tonight to kind of observe and just be a part of the conversation. I don't know that I want to go through all the detail of this because we are on time constraint, but I do encourage during the question and answers, if you have specific questions around this, that maybe we can dive into that if that feels helpful. So I'm going to, yeah. So in the plan, there is the aspirational number that we need 44 permanent supportive housing units. And so that is looking at the data of individuals that are living in our community. We have a high rate of people that are experiencing chronic homelessness. So that means they've been homeless for a year or more, homeless more than 4 times in 3 years, and have a disabling condition. And so 50% of the individuals living in our community meet that definition of chronic homelessness, which is different than a lot of other communities. And what that tells us is that we need a very specific housing intervention to support those individuals. This is not an individual that may be intermittently homeless and needs an intervention known as rapid rehousing, where it would be a security deposit and first month's rent and maybe some light housing case management once they move into housing. Permanent supportive housing is really affordable housing at 30% of your income and paired with services. So case management, linkage to mental health, substance use, whatever the needs are of the individual, just like you or I may have different goals in our life, permanent supportive housing is tailored to meet the unique needs of those individuals. And we can't prescribe that you have to be sober, that you have to be engaged in treatment, because that doesn't work for a lot of individuals. It's really about meeting the person where they're at and offering them services and engaging them in re-establishing themselves into the community and living a thriving life. And so based on the number of chronically homeless individuals and the individuals that aren't going to resolve on their own, we came to the number of 44. Whether or not that's realistic will be determined. So we will have, after Pacific Crest Commons, we'll have 24 units of permanent supportive housing, and then we can identify, from there, where do we go? But the unmet need currently is the shelter, and that we don't have anything. And so Town of Truckee had identified that was the area that they wanted to focus on in looking at a navigation center. I think there's a lot of ongoing conversations to have about how we do something like that, because again, cost, provider, we want sustainability. The reason why the emergency warming shelter is not continuing is because it's such a hard model to sustain. You have a weather-triggered shelter, you have to have staff, and you have to the people that are going to use your services have to know when you're open. And if you're not open consistently, it creates a lot of uncertainty and instability, which makes it really challenging to operate a shelter that is successful and that ends homelessness. When I ran the emergency warming shelter, there was 55 unique individuals that accessed services, yet because we were operating the way we were operating, there wasn't case management. We were simply maintaining safety for everyone, so there wasn't case management services. There wasn't linkage to housing. So at the end of that program, there were 0 people that left that shelter to go into permanent housing. And so we really want to look at setting up a model where we can be successful in ending someone's homelessness, because it is incredibly expensive to run a shelter. And so we really want to be changing people's lives when we're offering these services so that we can end the cycle. And then Ted talked a little bit about the partnership structure. At this point, we don't have a lead entity that's driving this work, and so we're really looking to establish a Tahoe Truckee Homeless Advisory Committee 2.0, and what that looks like will be coming back to you to share about that once we have the structure in place. But we'll be looking at continuing the implementation strategies of this plan. So looking at setting up work groups around navigation center. We have permanent supportive housing already in the pipeline. We have affordable housing. And so really just continuing the collaboration, because we cannot do this work in silos. It is not a government problem. It's not one entity's responsibility to solve. Homelessness is a community problem. And I truly believe that homelessness is caused by lack of housing. And so how do we fix that and provide a welcoming space for our community where there is a safety net for people to be caught when they fall? there's studies, a statewide study of homelessness showed that once you enter into homelessness, the longer you stay homeless, the harder it is to get out. And so we have individuals that have been homeless for years. And if we had a suitable intervention for them at the time when they first became homeless in this community, I wonder where they would be today. And so that's everything I've got.
Actually, I'd like to ask you if you have the answer. Do you have data with respect to the homeless numbers that we have of people that are transient and people that actually this is home? Because that's another very interesting component.
Yeah, so our HMIS, that's our case management system. So those are individuals that are, they've been in the area for at least 2 weeks. So in order to get on that case management system, we go and we have them entered into what's called coordinated entry, and they do that with a case manager through North Tahoe Truckee Homeless Services. You can also do that by calling 211. But that 78 individuals, those are our locals. We have many people experiencing homelessness that live in our community, and we see some of them, and a lot of them we don't see. We have people that are working here and living in their cars. They're camping in the campgrounds. They're figuring out a way to live here. And so that's the smaller core number that we are trying to solve the housing solutions for versus the larger number, which was, I think, 117 on one of the slides. And so those are the people that are coming in and out of our system. But they're also going on to the next place. They're getting linked up with family members maybe outside of the area. So North Tahoe Truckee Homeless Services does a really good job of engaging individuals on, is there a place we can help you get to where you have some stability? And so they are constantly paying for bus tickets and train tickets to get people linked back to their communities. And then there are the individuals that are here because this is their home.
Back to you. Ready for questions.
To the board, any questions?
Thought I was serious about the 87 slides.
Yeah, I do have a question. I read from time to time that there are, at least in warmer climates, individuals who shun any help. They don't want to be given help and assistance in housing. And I'm just wondering, is that a factor here, given the fact that we have very cold winters, and I'm just wondering how that factors in.
Homelessness is a very complex issue. I bristle when I hear statements like that. I've been in social services for 20 plus years, and that is not a new concept that people share. And I don't agree with that statement. I think that sometimes people choose the best option that they have available to them. And oftentimes there is a lot of complexities on why someone is homeless. And that's where the case manager and the behavioral health team and the clinical team it's their role to meet the person where they are and understand what are the barriers for that specific individual to end their homelessness, because it looks different for everyone. And so that's how I will answer that tonight.
I'd like to just reframe, because I want to this could be a long topic, and I was at the town meeting, and I've talked to many people about this, so I want to make sure that I am what I'm talking about. So the summary and objectives we have today is obviously accept this plan, homeless action plan, or provide direction to staff, continue participating in the plan with the initial focus on navigation, center services, community engagement, and outreach. So that where I'm coming from today, because we can go in the weeds. I thought it was very interesting in the plan that when you look at this, what they use, because being in the hospital, because again, you have a lot. What you just said was a lot, and I wrote a lot. So I think that we can go in many different ways. So I want to just have a discussion or ask the board, really looking at this and at this document. When you look at the services, there was you have to help me. There was a survey of like 25 people for this, and they said that one of the second most popular service was the hospital. Yeah. So I think that's a very interesting point. And I've had conversations where I said, oh, well, we can get people to that place where we can get resources and have the hospital. Or is the question that we need to be very geographically supporting a navigation center. So I know that's a topic that I don't want to discuss here right now. That's not the topic, but I want to really understand, like, as we think about these, we have to think about this. The hospital has to think about this. How can we support? Is it bringing resources to them? Is it bringing people to us? Or is it identifying what those sources are? Maybe it's just one source, because I wasn't really sure what those sources were. So I don't know if there was anything more in the plan that actually led us to believe what are the exact medical sources that can be supported for the homeless.
So, Ted is whispering that that's phase 2. But I think that, homelessness is complex.
I'll interrupt, that's fine, I'll save you. Please let me tell phase 2, so tell me more about phase 2 then.
I think that everything that you just identified is what needs to be identified in phase 2.
Okay.
That's going to be the harder lift. That's
Okay.
the big, heavy lift.
All right.
So, yeah, we can look at that data and see that the hospital is on part of the target list there, but we have to navigate that and architect that in a way that we are playing a proper role in design of navigation. That's a big part of navigation.
Then I guess okay, thank you, off the hook. Good for you. I guess my question then is, hearing that, this should be not just one entity, but led as a group, what has worked in phase 1 and what has not worked in phase 1? Like in terms of, did someone have to step in? Did not? Again, when you have a whole bunch of people in a group, there's no one leading. If you have one person that's leading, so I was curious, what has worked in phase 1? Was it coming together? Did you have to identify a true leader? Was there a partner? I see the MOU as an example of the next steps. So I'm curious of what really worked to get phase 1 solidified and what would be that outline for phase 2.
I think it's fair to say that this, as long as I've lived here, was the first time that a partially community-funded contract was let with a consultant like Agnew Beck to really, this is all they're doing for us, and really dive deep into it. There's never been a report like this in this region that goes this deep into what the gaps in analysis and the issues are related to homelessness. So I think the next step, the MOU, will be very detailed on the heavy lift and the development of navigation systems. But you also, with navigation systems, you have to identify where you're navigating to and why. And so historically, I will say, a lot of the services that exist are provided by the counties, and they're focused historically in Grass Valley and in Auburn. And that's by design of the county. That's the geographic design of the county. There's no, in my experience, there's no extra funding to replicate entirely a service center up here and have 2 in one county. That's a very difficult thing to do, and it's a challenge. So part of the design of phase 2 is going to be how to better interconnect with services. I think we've come a long way, by the way, since you've been here in provision of services and care coordinators. But I think the second phase is going to be much more specific in those areas, because the counties do have the services. The hard part is that you can't take somebody from up here where this is home and say, go to Grass Valley, because you know what they do is they find their way right back to home.
Mm-hmm.
And so I think there's a lot you can add to this answer, and I don't know if our guests might want to add as well.
I would say that one of the challenges in this region is that our numbers are small. And there's also a lot of funds out through the state of California, through the Medi-Cal transformation process, funds that we can access. There's new ways to bill for services, and there are grants that have come and gone and will probably come again that can fund interventions for homelessness. And so we will be focusing on how to bring those funds into this community. And those funds aren't going to meet the entire need. And so there will need to be collaboration around, okay, we have this grant, we can generate some billable revenue, and we have a gap of this amount of dollars. Community, how do we come together to meet that need?
At what point do you think you'll have that number?
Which number?
The gap number, what you need?
Well,
What is the
Yeah, so one of the strategies that we'll be doing is setting up a work group to explore the navigation model, because there's a lot of things. It's how many people are we serving? What's the population? I believe that it's going to be the chronically homeless individuals, but there's a lot of questions. What about families? What about all these other individuals? And so we need to hone in on that. And then we need to find a site, and we need to know how much the rent is going to be. And, so at some point in this next year, I hope that we have something. I've heard a lot of passion around wanting to make this happen, around having a shelter. And so I believe that our community can do a lot when there's passion.
I'm going to add something to that on the housing side of things. You might recall that the county got involved, and the county supervisor got involved with transitional or supportive housing in Truckee, and it caused a lot of strife in that particular neighborhood. One of the challenges is going to be, again, just like what happened there, is where. So I think the town is a good partner to try to identify where, at least on this side of the hill. We've got some things going on over in Kings Beach and in other areas. But very often, the grant funding that comes and goes was part of the driver of why there wasn't a lot of community input on that, because the funds came, and for the first time I've ever seen the county really be very, very supportive of putting them up here in the far reaches of District 5, but it was too fast for the community, so those funds have gone. They've gone somewhere else. So there's going to still be that challenge of trying to match up. We've got homework to do up here, match up where something might go, how those funds may be used when they arise, because they do come and go, and they go quickly. Fair? Okay.
A few questions, many of which have been answered, so thank you. The one I was really afraid to ask was around relocation, because that could come off as really callous, but you addressed that. For some people, that is the best option. It will always be expensive to live here. I don't see that going away. So we talked about short-term and transient transportation, and that might have been in the response you just gave, Ted. But if I'm in Truckee and services over in Kings Beach, I didn't see that in the plan. Is that?
So behavioral health services are provided by the county, and so that's always going to be driven by the resident of the county residents. So if there is a program it's going to be based on someone's Medi-Cal, and so if there is something in Truckee, then those services are going to be provided at the Truckee office, Nevada County Behavioral Health. If they're in Kings Beach, then there's services are through Placer. We also have a lot of our providers are regional, so Sierra Community House serves the region. North Tahoe Truckee Homeless Services serves the region. And then from there, they make referrals to the specific services that are needed that might be county-driven.
Okay. But the same graph that you were referencing, Rob, TART was listed as what's working well. So does that factor into? I'd assume many of the homeless are also without transportation.
Yeah, and I would say that currently our meal distribution through North Tahoe Truckee Homeless Services is happening at the Joseph Center across the street. We have individuals coming over from Kings Beach to access those services. Before it was at the Joseph Center, it was over in Kings Beach, and we have people going over that way. And then case managers also provide transportation, TART, and people are resourceful and get to where they need, just like anyone else in this community.
Where they need to go, yeah, okay.
So Jasmine, in the report, there were some recommendations, and I wondered if the timeline was more aspirational than real, because they're talking about having something up and running this winter. So can you speak to that, or where are we with that, and is it going to be a reality? Because again, last winter was a nightmare. Thank God it wasn't the snow that we had the year prior. But again, there were people who needed shelter.
It was cold, yeah.
I would answer that it depends on the community will that we can generate. I mean, we have a provider in the room that is listening and wanting to support the efforts. So can our community and our partners come together to find a location and funding? Because those have been the two roadblocks.
And who is going to be that? I mean, we still don't know who's leading the group per se, and I think that's the person that there needs to be some person that's going to bring us together. It can't be some amorphous that's out there.
So the town of Truckee and Nevada County have both committed
To the plan.
funds for implementation. And so Agnew and Beck is available to continue that work. And really, it boils down to this logistical thing of who's paying the check. And so who's managing the contract. And so we are almost across the finish line on figuring out who that entity will be to hold the money and then have the contract with Agnew and Beck, who will then continue the work.
But then again, where is it going to be? Because that's the biggest issue after listening to what happened to Hope Ridge, that, nobody wants it in their yard. But all the yards are taken. So where are we going to put it? And we definitely need it. And you drive around, and you go, well, that's empty land. Maybe that land belongs to somebody, or that, so there's so many obstacles to figuring that part out. And again, do you want it on a main street where there's traffic that can take them, transportation, that's walkable to some place that they can buy food if they need to? I mean, there are so many things that we're looking at. Is it going to be really possible to find a place?
Let's say yes.
Yeah.
Yeah, I mean, to me, it's an interesting dynamic. Like, if you ask anybody, like, oh, of course, I think we should have something like that. And then you say, well, we're thinking of putting it in your backyard.
Yeah.
And the answer probably changes a lot, So I think places, but it also speaks to, if you walk some of the neighborhoods, San Francisco, LA, Chicago, the numbers are much bigger, and it's in your face. Like, you can't deny it. How much of this exists in the shadows in our community? I mean, you see the occasional individual out front of Safeway, but that's 2 or 3 people. Clearly, we see here in the emergency department and whatnot a fair share, but how much of this is just the community's not aware how big the challenge is?
I mean, that number of 78 individuals is, there's different ways of counting homelessness. One is a point-in-time count that happens in January of every year, where Street Outreach goes out and counts the number of people literally homeless and the individuals sleeping in the domestic violence shelters. And 78 is, that's about the number of people that are here in our community, living, working, existing, surviving, that are right now.
Mm-hmm.
I think the one example of that was given, I think, at a town hall, or maybe it was at town council, where moving people from the area out to other places. And that doesn't work because they can't navigate things down there. They don't have the confidence to do that, and they wind up coming back to where their home is. And so if they're coming back to us, and this is their home, then what is it that we can provide for them?
And I would also add that there is a shelter shortage across the state, so we can move people to Sacramento. There's no beds in Sacramento. That's the challenge. And I live in Truckee. This is my home. I'm not going to move to Sacramento. I don't know people there.
Thank you, Michael, because I'm going to quote you. We often talk about the fact that we exist for health care, not just sick care. And, you can't be healthy if you don't have secure living, if you don't have a secure food source, if you don't have the clinical services. And, we need to do our part.
There's a very high utilization of the emergency room as primary care when you're living on the streets.
We're aware.
Yeah. Any other comments, questions for the board?
I just have one. I want to get clarity. I'm sorry. It's really great and taking notes, but I want to get clarity. You said, so I want to make sure the next step, you have the funds, it's who will be giving the Agnew back to continue the consulting work. And are they taking the point of suggesting areas in town that would be the next step to have this? I'm just, because I understand the county, and the town, that I understand who has relationships, that's it, but who, again, I'm still stuck on this collaborative and who's going to be taking that first brave step to say, okay, guys, town, county, hospital, all the people, all those fine people that have really spent all this time in it, these are the steps, let's go ahead and talk and agree on that. How is that going to play out? How should that? Is there an idea? Has that been even thought of, played out yet?
Oh, yeah. I think that's the part of the collaboration has got to be with Agnew Beck
Okay,
and the town of Truckee
gotcha.
on this side. Okay, we're dealing with a broader area, We've got, the Kings Beach area, and we've got Tahoe City area to deal with too, but we're the black eye right now on the whole thing here in Truckee. And that's going to definitely involve the collaboration of the town, and I think they've taken a wonderful first step by not only accepting the action plan, but also putting forth earnest dollars to begin to work in that process. They know they're the major collaborative partner on that. Is that a fair assessment? Okay, so I think that's where it's going to happen, and I think that's where the coordination is.
Thank you.
We'll be a part of it. We will be a part of it, but we don't do land use here. Can I have you?
Yes, Deb.
Thank you. So I would just say, following up on Ted's comments, it's not only the town, but it's also Nevada County, Placer County, the chamber. It's like all the partners coming together and really working to identify a site or whatever like the next very clear steps are, and that will happen through collaboration.
Okay.
You know, the thing that you brought up is to find a site. I think once a site is decided, that could be a real impetus for the philanthropy and all the other things. I've seen that with other things that are coming. We look at the kids zone, we look at the library. They had the property, and the money started coming in as they started doing the fundraising and, making it known that this is what we want to do.
Right. It gives something for people to rally around.
Yes.
For sure.
Any other comments from the audience, questions?
Hi, everyone. Megan Shirley. I work here at the hospital, and I'm a lifelong resident. And Jasmine, thank you so much for your presentation. And Ted, I think it was really interesting to learn about, really important. And so I'm glad the conversation's starting, and I'm hoping that that momentum and that positivity that you have, Jasmine, is going to take off.
All right, thank you. And yeah, just closing comment, we as a board tend to ask a lot of questions and love clarity. But I don't want anyone to interpret that as a lack of concern or questioning is there value in this? And I think I speak on behalf of the board and echo what Mary was saying is when we consider the health of the community, it doesn't exist just in this building. And so we do recognize this as a very, very serious and timely problem that does need to be addressed. So thank you for the presentation.
I think
We're hopeful
We will,
that you'll
yeah.
accept the report.
Yes. Well, then let's go to them.
I'd like to move that we accept the Tahoe Trucking Homeless Advisory Committee's action plan and provide direction to staff to continue participating in the homeless committee work.
I second.
I think you have a motion and a second. All in favor?
Aye.
All opposed? All right, approved 5-0. Thank you very much. All right, moving on, item 14.2, a public hearing.
Oh, yeah, this was a good one.
Give everyone a minute to shuffle around and clear the room for this. This is the first time that we've had a public hearing since I've been on the board in 4.5 years, and the first time as chair we've had one. So asking for a little leeway as we go through this for the first time. But just an introduction for everyone here and probably even some of the board members. Effective January 1st, 2025, Government Code Section 3502.3 requires the Tahoe Forest Hospital District to present information on the status of employment vacancies and recruitment and retention efforts at a public hearing before Board of Directors at least once per fiscal year. We are also required to identify during the public hearing any necessary changes to TFHD policies, procedures, and recruitment activities that may contribute to obstacles in our hiring process. At the public hearing, recognized employee organizations for a bargaining unit are entitled to make a presentation to the Board of Directors addressing the status of vacancies and recruitment and retention efforts for positions within the bargaining unit. The purpose of these procedures is to establish protocol for TFHD's public hearings on vacancies in order to ensure a fair, orderly, and efficient hearing process. Tahoe Forest Hospital District reserves the right to schedule separate public hearings for different bargaining units and is not limited to one public hearing to address all vacancies and recruitment and retention efforts within the district. So just a little bit about how this is going to go. We'll open the public hearing. We'll receive a presentation from district staff, and then each bargaining unit of the district will have an opportunity to present. Follow that, there will be opportunity to ask questions from the board and staff, and then a response period on that, and then we would close out the hearing. So with that, we'll go ahead and open the public hearing and start with the presentation.
Actually, thank you, Chair. Anna Roth, your president and CEO, and we are here, I'm joined here tonight by our our COO and interim Chief Human Resources Officer, Louis Ward. He has brought staff with him, and they will be, actually Lauren and Lucy will be guiding us through this discussion, but we appreciate the time to hold this hearing and to meet our needs with tonight. I'm going to hand over to Louis, and I know you brought staff, so.
Yes, Chair McGarry and Board of Directors. Well, as Anna said, I'm in acting, and let's go ahead and put that in bold letters, acting. And that is why I brought some very talented individuals with us here. So we have Lauren Caprio and we have Lucy Wright, and so they are prepared tonight to talk through AB 2561 and our compliance with that, and as well as some success stories around our vacancies. So I'll pass it over to them.
Good evening. Thank you so much for having us. So just to kind of summarize what AB 2561, it was created to bring visibility and structure and shared accountability to the process of addressing staffing shortages in public service agencies in the state of California. So that's why we are here tonight. Some key requirements of this is to engage in an annual public hearing, and this must be held before adopting the final budget each fiscal year. So we're on that journey right now. Topics to address are the current job vacancies, recruitment and retention strategies, and policies that may be hindering our hiring process. Additional reporting, if there is a bargaining unit that has vacancies that exceed 20% of the authorized full-time FTE, additional metrics must be disclosed upon request. Luckily, we don't have any additional reporting metrics that are mandated for us this year based on our current numbers, which we'll go over next. And then lastly, employee organization input. So our recognized labor organizations, both our EA and our EAP, must be allowed to present during this hearing as well. I did speak with our union president, Julie Morgan, and she unfortunately can't be here tonight, but she did not have any big concerns or comments based on the report that we sent her. Now I'm going to turn it over to Lucy, to our recruiter.
Okay. So with the law, we are required to take a snapshot of our vacancy rates at one given point in time. So we just chose to pull data from May 1st. So we will continue to pull data from May 1st here on out. We have two bargaining units. We have the Employee Association and the Employee Association of Professionals. Our vacancy group for all of our bargaining unions was well under the 20% threshold. Our highest being the EA, which has 515 full-time budgeted positions with 27 vacancies, which gave us a vacancy rate of 5.26%. And then our lowest was the EAP. We had zero, we have 200 full-time budgeted positions with, as of May 1st, had zero vacancies, resulting in a vacancy rate of 0%.
Okay, and then also to comply with this new government code, the district must also address the retention efforts that we are currently doing as a public agency, and the district has not really experienced any challenges related to retention. I did put some metrics up there for you that you can reference, but below is a summary of an average employee's tenure by their job family. While we're not required necessarily to report on positions or job families, as we call it in human resources, outside of the collective bargaining units. We just chose for transparency reasons to show you all of the numbers for the health system. So just for comparison, as I noted in this report, the U.S. Bureau of Labor Statistics reported a median tenure of 3.6 years for the health care industry as of January 2024, and the district's current median tenure is 6.8. So this indicates a strong employee retention relative to what our industry standards are. Also, I thought I would just put out a couple fun facts for you that were not included in this report, but our turnover rate we calculate based off of the calendar year, not the fiscal year. So in 2024, our turnover rate was 12.2% overall through every job family in the organization. And then the U.S. healthcare from 2023 to 2024, the average turnover rate for our industry was at 18%, according to Press Ganey. So that's we're still below that. So I think that's excellent. And our current employee count, based off of these numbers, as of May 1st, was 1,423 employees. And that includes our employed physicians. The district is also required to disclose any changes to our policies, procedures, or recruitment activities that may adversely impact the efforts to fill jobs. And at this time, we don't have any changes to any policies or activities. Nothing has changed in the past year. On the contrary, the district continues to prioritize and proactively be proactive with our candidate communication, and Lucy does an amazing job, always consistently highlighting our health system's culture and benefits. So some of the recruitment and retention strategies that we use, or that Lucy has used, and that we love to brag about, are, we have market-aligned salaries, comprehensive health insurance and retirement plan benefits, on-site childcare, our gain-sharing program's a good seller for candidates, education reimbursement, tuition reimbursement. Years ago, we instituted the APP student loan repayment assistance, and having our own in-house program to help recruit and retain advanced practice practitioners. And then also our partnership with Truckee Tahoe Workforce Housing is also a really great seller for our physicians as well. And then our strong relationships with the union over the past several years. So while I do understand a lot of we just came off of the homelessness topic, and housing is very expensive here, and that while it can be a barrier at times, somehow we still are able to get people in, and we love that for us. So yeah, that's all we have.
So sorry. So with that, Chair and members of the board, Ms. Caprio and Ms. Wright are available to answer any specific questions you have. If you have no specific questions, or once those questions are answered, we actually are asking for you to approve resolution that's attached here, 2025-6, which adopts the procedures for holding this public hearing, reporting on it, on the district workforce vacancies, recruitment and retention efforts in compliance with AB 2561. And you have the government code there attached. It's in your cover sheet. And with that, we'll hand back to you, Chair, if you have any questions, or if anyone in the audience does.
So we will be doing this annually.
Yep.
So in May, probably, we'll keep having you two or somebody coming back to do that. I know in the past, our human resource officer would come and give a report about the number of employees we have and the number of, not necessarily vacancies, but who has come and who has gone, not specifically, but by category. So that will continue, but this annual will always happen.
Yep.
It just has to happen before the adoption of the budget. So technically,
Yep.
it could happen at a special meeting at the same day that you were
Doing the budget.
considering budget adoption.
As this is a new law, what we've been observing from other districts, other public agencies, is actually the creation of a policy around this effort. So a policy and a procedure that would line out, what will be presented, when it will be presented. So we're actually going to work on putting a policy and procedure together that will keep us in compliance with AB 2561 and really define when you will see this as a district board again.
Remember to put the risk statement.
Yes. Oh, we're
No doubt. We know that.
Wow, check that box. Nicely
Our risk
done.
watchdog.
Thank you so much. Kudos. This is something to be very proud of, and thank you for giving me more information and such a great presentation. It feels proud to be here and see the work and retaining. When I was on a campaign trail, people who worked here raved about the nurseries for their children, and it was just like a hot topic. It was lovely to hear that when you come to work, you can take your kid here and have your kid taken care of, and again, I just really appreciate that. I wanted to make sure that, again, just get it, I guess, out there. The reason why this is because if we are 20% exceed or meet 20%, then we have to explain why. Right, this is the why, and I think I just want to make sure that again, if everyone's watching from that, you have to say how many number of vacancies you have, the total number, the number of applicants, the average time to fill positions, and the opportunity to improve compensation work conditions. So essentially, I'm reading into that. Again, my own part is basically just making sure that you're filling the spots and you're not holding and being not fair compensation. So again, it's just lovely to hear that it's so low, and again, and I appreciate you really even give us more information than is required. So the one question I have, OPCEA, EAP, and OPC EAP, what?
So the way we do our job families is, so we have two collective bargaining units, the Employees Associations and the Employee Association of Professionals. Within those two collective bargaining units, OPC stands for outpatient clinics. So they still fall under those two collective bargaining units, but they have some differences in their, in our union contract that we have an addendum to. So when we go into contract negotiations, those will all be incorporated into that MOU, but OPC just really, for us in HR, distinguishes who works out in the outpatient clinic and who is here in the main hospital. We knew you were going to ask that question. We should have learned.
Getting a reputation already. I am done with questions.
The new guy on the block.
Any others? Mary?
No.
No? Any from the audience?
So now we open the public hearing and we invite public comment. And once that's completed, then you would technically close the public hearing. So that's the procedural posture of the public.
I thought I already opened it. Did I open it prematurely?
Yes, you do.
Okay. Well, I'm going to go ahead and reopen the public hearing and look for any public input.
You have to gavel.
No, you
Go
don't
ahead.
Public hearing.
Okay, we're open. Any public input? Seeing a lot of no, 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 no. We close it just as fast as we opened it? Is that, all right, we'll close it. And then the ask on the table is there's a resolution 2025-06, which essentially outlines the procedure that we just went through, and we're looking for approval of that.
Go ahead.
The procedure that's in the resolution, because the legislation is very vague. It just says a bargaining unit has the opportunity to provide a presentation. Doesn't say anything about how they even learn that they have that opportunity, or when they're supposed to learn about that, or when they're supposed to request this additional information if there is a 20% vacancy. So the procedure that is being requested that the board adopt simply lays out a process for that. I think it's like a 10-day notice to the bargaining units. Then they got 5 days to decide if they want to present, and then staff will know whether or not that needs to be put on the agenda, such that there's that extra time available. And so that's essentially what we're doing here with the procedure. And the fact that this is the first time we're doing this, we didn't have this procedure ready prior to the time that you needed to conduct this hearing before budget adoption. So essentially, we're doing it now for next year's public hearing.
I don't know if I saw that detail on.
That is on page 160. of the packet, I believe.
160.
Well, but within the
No.
resolution itself doesn't,
No,
has-
it attaches.
it attaches, okay, okay.
Okay.
The resolution says we approve the attached procedure for public hearing. Exhibit A is the
Understood, thank you.
procedure. There's a notice requirement. And then there's a provision for the order of the hearing. And, you know, this is simply our own procedure to help
Yep.
move things along. It's not required, it's not legally required that we have this procedure, therefore we didn't necessarily follow it, but as staff indicated, notice was provided to the bargaining units in advance of the public hearing, and they did indicate that they did not have a presentation to provide. So if I can answer any more questions about that, I'd be happy to.
Okay.
So we're flying the plane and building it at the same time. Wow, that was impressive.
Chained to the tire on a moving car. You know, you
This has to
pick
be
your
approved
analogy.
by a roll call vote? A resolution?
No, you can
No?
approve it with a voice
Okay.
vote.
Okay, so assuming there's no more comments, questions, input, we would look for a motion to approve the resolution.
I'll make a motion to approve the resolution number 2025-06, which adopts procedures for holding public hearings and reporting on Tahoe Forest Hospital District workforce vacancies and recruitment and retention efforts in compliance with Assembly Bill AB 2561.
I'll second that motion.
All right, we have a motion and a second. All in favor?
Aye.
All opposed? All right, resolution approved 5-0. Thank you, everyone. We have no items for board information tonight. There were no items pulled from the consent calendar, so we would move to board committee reports.
Well, I would be one. In fact, I might be two. The Quality Committee met, I'm trying to find my notes. In any event, we met in the beginning of May, I think, and we had reports from the Advisory Council. Dr. Evans and Anna presented, they presented that Anna and Dr. Evans had come to their meeting and presented the Access to Care project. And they also were interested in the comment that was made that the health organization would like to maybe leverage the PFAC, the Patient, Family, and Advisory Council, for future input on improvement initiatives. The program Beta, which is our insurance coverage, was here in April to validate the survey, and I think we're awaiting the final report on that. They did have a safety first that dealt with mock codes that have low volumes, and there was one on massive transfusions and another one that happens in the ER with transfusions. And because they happen so infrequently but are so critical, that they've made a resolution to have those mock codes on an annual basis at least. And then we worked on, for the Quality Committee, we worked on edits to our charter. They're still in the works. Conceptually, we're there, but we're, again, working on some of the details of our charter. Then I also chair the Executive Comp Committee, which met this week, and we went through the job description for the president and CEO. And a lot of the things that we're looking at on the Exec Comp Committee, we're going to hold off on making anything final until we have our permanent chief human resource officer in place to help us with some of the verbiage on job descriptions, looking at job descriptions not just of the CEO, but also of leadership. We're looking at the criteria for the CEO for 25, 26. Is that right, 25, 26? I always get these screwed up. But in any event, again, conceptually, we have it there, but it's the details that we're looking at, and maybe having a compensation expert come in and help us with that. And so we will not hear anything from us until after July in terms of what the criteria is going to be for the incentive compensation. And so that's.
Do we consider the current structure to have either limitations or not be aligned with strategy, or what are some of the changes being, recognizing details are fuzzy, but
conceptually, we're looking at.
What are the things being
Yeah,
considered?
we're trying to connect them to our aspirational goals, our yearly ones, as well as the 5 years. And that's going through a little bit of a transition right now, coming up with more definitive versus some of the ones that we didn't think we could really measure as well. Do you want to make a comment on that, Anna? Because I know that you were a driver of one of our discussions.
I think we have some work to do on this, and I think that, I am trying to support, I think, where we're headed. You saw in the CEO update, which is sort of thinking about, I think I used the term, teaching to the test. If you put depending on what you put on those measurements, it's a values statement. And so I think that, there's a couple of risks, and I think this is and so I do think bringing in a comp specialist or sort of carving out some time to really think about it. But for instance, the affordability sort of thing, you may decide that really matters as a board and that you really want to push the CEO to be working on something and tie incentive comp to that rather than something that maybe, maybe you've had, and we've been sort of hitting that mark for 6 years in a row or something, and so again, I think that but I also think that, we run the risk, it's always a risk to sort of, attention there, like how do you have an aspirational enough and stretch goals, and also, and again, sort of putting aside, because I just got here, so I have no complaints or, issues here. And in fact, I don't think my contract's even 90 days old. So this isn't really about me, but this is about, making sure that we don't inadvertently have, discussions like, well, wow, we hit all the marks, and so that must not be good enough, because that does ripple out. I mean, the board would not want to be saying that. I mean, we would not want to be sort of a body that doesn't think doing really well is really great, but we want to make sure the stuff that you really want to tie incentive to are the stretch things that maybe really matter to the community that maybe you don't have the right measures for, and you feel really comfortable in the current performance or even the stable performance over the last 5 years. So those are the kind of things I think a comp specialist could come in and possibly work with the committee and even possibly the board, because I think this is a large endeavor to start to think about those things, because it's a change. It would be a change. So, and I'm here for it, but I think we just need, I would suggest this is actually work of a professional that sort of has lots of deep expertise in how you kind of set these things up, because it really does end up, you get what you aim for. You get where you aim. And so, that's just the way it is. And I think that there, how do you kind of start to aim for other things and hang on to everything that's great about Tahoe Forest too? I mean, so that it's got to be really well thought out. So I wouldn't want to shoot from the hip. So I appreciate you asking my input, and I would agree with what Director Chen is saying, which is we need an expert in here. I mean, sorry, Wong. I'm so sorry. I was thinking of somebody else. I'm sorry. But we really need to bring an expert in, I think, to help us if we're going to start tweaking that. My recommendation would be that. But, I defer to the committee and to the board clearly. And I think that there's a lot of thinking to do about what matters to the board. And that's really what my answer was when they sort of asked me point blank in the meeting, like, what do you think we should do? I said, well, I think we should do what matters to the board, who the board is, in fact, you are elected by the community. So you're our closest conduit and our deepest conduit into the community, aside from like the PFAC and the members of the community themselves.
And you remember, we also said that the next permanent HR individual could perhaps also assist us in this effort.
Well, more into our job description. I thought that's where we would use the interim from, but the interim can help us get the specialist.
What I thought is if we bring an interim in, which we probably will bring an interim in, that it might not be the best use of their time to like revise the CEO job spec, but that might be something that the permanent could do, because I think, I'm assuming you probably fairly recently revised the job spec when you went through with a recruiter and all of that. Maybe I'm wrong on that assumption, but I think it can wait. That part can wait, but the comp, the incentive comp, I think what the committee is really seeking is to refine what that comp looks like, those incentives look like. And that, I think we could either bring a comp specialist, or we may in fact have if the interim is a certified comp specialist, because it's not actually the case always that an HR professional may or may not have that expertise. If they do, then I think that's a very scoped piece of work that it would be probably okay for an interim to help. But I think like things like job descriptions and that sort of thing, that's probably for the permanent replacement somewhere down the road, unless there's a problem.
That's what we agreed to in the committee, is that the permanent would, and that there were enough things that the interim would have to do just, as the interim, that bringing in a specialist would be better than having him or her work on that, because there were enough things in HR that.
Yeah, I mean, and I would just say, of course, I agree with that. And of course, if the board, like if there's a problem that arises, we can then redirect that person. But those are that's the discussion. I'm kind of trying to repeat the discussion about what we had over the last two meetings. And I hopefully I've sort of summarized what we stated.
Again, I think the key is that there are some parts of the criteria for the CEO that we want to keep, but there are some that we really believe should be focused on affordability, accessibility, and some of the other things that we've heard over and over from our constituents and our employees.
Well, really, actually, I'm incredibly excited, looking forward to seeing what the committee comes up with, and
So are we.
The general direction, I think, is incredible. No, but I mean, just building on a point that Anna made, it's shifted a little bit over the years I've been on the board, but, 4 or 5 years ago, a lot of the incentive comp was tied to the financial performance of the organization, and I had more than one comment unsolicited to me going, well, we know what matters to the hospital. So to your point, I'm like, it's a statement, what we put out there. So looking forward to seeing what you come up with.
There'll be more to follow.
Any other committees?
The Incline Village Foundation met. I continue to be amazed at the tremendous amount of funds that they raise annually, and yet it doesn't diminish their desire to raise even more. And they're always anxious to identify new programs, new projects, new equipment, new renovations, and then go find the money. And they do. They find the money. In your packet, too, was they have a new member, Leslie Whitman. Her resume is part of the packet. If you read it, it's quite.
Agenda, yeah.
Consent agenda, yeah.
Yeah, it's pretty amazing. So anyway, I continue to be buoyed up by the tremendous work done by that foundation.
I'll just give a quick plug for the community. Obviously, the community engagement, we're under the pillar for our community to aspire to be an integrated partner in an exceptionally healthy and thriving community. We live under the Community Health Index, and so, our goal at the end of this fiscal year was to have 5 out of 5, and we're currently at 3, maybe 4 I'm hearing, and so the exciting news is our meeting is next Wednesday. If you have any time, make sure you look at the agenda. I doubt the agenda will be released soon, but you can imagine this is the end of the year. So I'm excited to look forward to that meeting next week, and and hearing the public saying that they want, this is a community engagement meeting. Thank you, Sarah. I want to give credit to Sarah for really thinking ahead of us planning the next one in August, so we can start thinking this in a regular cadence, and so people in the community can plan ahead and attend. That's it.
All right. Thank you very much. Closed session was nothing, no need to continue there, so we will adjourn. Thank you, everybody.
Thank you.
Here, here.
There you go.